I'm pleased to welcome you here today for the lucky number 13 in a series of conversations we've hosted on the various aspects of the business and economic impact of COVID-19. Today's conversation will discuss the data that we're encouraging policymakers and business leaders to utilize when considering reopening decisions, particularly as new cases of COVID-19 continue to tick up nationwide. We have a terrific slate of experts lined up, and I'm going to let them take things over here shortly. But before they do, a quick roadmap for how today's conversation will go. We're going to hand things over to our experts here shortly. Each of them will share a few insights from their individual areas of expertise during the first half of today's conversation. We're then going to open things up for Q&A during the second half. You are welcome to submit questions anytime during the conversation. You don't have to wait until the second half. So for reporters who are joining us via webinar, you are welcome to use that Q&A function there at the bottom of your screen. For those joining us by phone, you are welcome to email me your questions. My email address is mackenzie_ab@Kenan-Flagler.unc.edu. And again, you're welcome to submit those anytime. So glad to have you all with us. And with that, it's my pleasure to hand things over to our first speaker, UNC Kenan-Flagler Business School professor and Kenan Institute Research Director, Christian Lundblad. Christian?
Thanks, Mackenzie. So I'm here to talk a bit about kind of what the NC CEO Forum is envisioning. So this represents an apolitical, nonpartisan collection of business leaders from across our state, working in concert with the Kenan Institute. And a central tenet of the forum is to help policymakers, business leaders, other important decision makers navigate the trade-offs associated with our economic reopening. And so economic activity is the lifeblood of American well-being. It's important, and that deserves consideration, right? So if the sole policy objective were to limit the spread of our virus that we're struggling with, then a lockdown would be a remarkably effective tool. However, while that was necessary, the lockdown has exacted a significant human toll along some other important dimensions, right? So reopening decisions, they've got to be made with an evidence-based process that holistically internalizes the spectrum of healthcare and economic costs, and I would say even permits a certain degree of informed risk-taking, right? So this has often been kind of classified as lives versus livelihoods. I think that's entirely a distraction of language. It's overly political. I think the situation is far better characterized as lives versus lives. So, much of the conversation in terms of the cost has sort of centered around the economic costs, but the direct healthcare costs, they're also quite significant. So we don't yet really know the full long-run consequences of unattended to ailments, right? We don't really know yet the full psychological costs associated with anxiety and depression and physical and emotional abuse. Certainly the explosion of unemployment, that risks detaching millions of workers from much needed health insurance at precisely the moment when access to healthcare is incredibly critical. And finally, from the standpoint of the health of the health system itself, right? In the face of limited elective procedures, these are central to revenue generation for these organizations. I mean, hospital budgets are rather dire, and this comes as many, and especially rural hospitals, they already risk closure from emerging financial pressures. I mean, these are critical issues for our state and our country, in fact. Now, in addition to these notable healthcare implications, the economic costs are also important. I mean, they demand serious consideration. There are, for example, very human costs associated with the long-run consequences of worker dislocation. So displaced workers, particularly in tough times like recessions and crises, they often suffer persistent earnings losses. And there are a host of other negative consequences: food insecurity, divorce, depression, physical health issues, and I think particularly important given the conversation about our schools, a lower level of educational attainment for their children. This has the potential to really exacerbate a rapidly growing problem of what economists in their recent book, Angus Deaton and Ann Case, called kind of, quote, deaths of despair. These are deaths that are linked to alcohol and opioid abuse that they attribute to diminishing economic opportunity. I'd say it's even more than this, however. So despite the sort of notion that's been floated around out there for the last few months that we're kind of all in it together, the frustrating reality is that these costs are very disproportionately felt across American society. The sectors, for example, that have been hit hardest, they employ a sizable fraction of vulnerable hourly workers, many of whom are working paycheck to paycheck. I think the uncomfortable reality is that laid off workers, and as well as those that have been deemed essential and are working in riskier environments, they're disproportionately African American and Hispanic. They have significantly lower household assets and base incomes. These are precisely the dimensions along which the disease and broader notions of injustice right now are being disproportionately experienced. So how best to think about these trade-offs? Look, if we're going to be honest with ourselves and look in the mirror, the reality is that a vaccine may be a long way off. And so our objective, to be perfectly frank, is not to minimize positive tests. In the absence of a vaccine, this is an illusion, right? Instead, it's entirely reasonable to expect that cases will necessarily rise as we work through the challenges of carefully facilitating critical economic activity. So what should our approach be in light of the very important healthcare costs associated with the virus? So we suggest that experimentation with opening should be subject to instead evolving hospital capacity. I mean, while the economic costs of the pandemic are valid and they do demand attention, no one should perish for lack of access to standard intensive care treatment. So instead, intelligent experimentation needs to carefully allow cases to rise without exceeding hospital capacity. And unfortunately, North Carolina, like other parts of the country right now, we're experiencing a significant upward trajectory in cases. This is in part to be expected as the virus is migrating to less affected areas and the critical economic activity begins to resume. But such an increase really only becomes highly problematic to the extent that it imperils the healthcare system from being able to sufficiently respond. And so in order to navigate these knife-edge trade-offs, I'd say, the government and particularly citizenry, we have a responsibility to behave well. So there are some caveats. I mean, as we imagine cases rising, there's some important caveats that I think deserve attention. Number one, we need to prioritize protecting the most vulnerable segments of our population. So knowing which cases are rising is really important, and that gets to the question of data that's going to be a focus in the latter half of our conversation. We need to also elevate the essential guideposts of testing and tracing so that we can better anticipate and manage hospital capacity. Additionally, there has to be a robust workplace and storefront safety protocol that's going to allow customers and workers not only to be protected as possible, but to feel protected. It's an important ingredient to getting out again and engaging in economic activity. And then again, we're asking more of some Americans than others. And so policy support should perhaps be targeted to the workers in the highest risk professions. So this is the cost-benefit framework that we're proposing, and it's informing several initiatives. So number one, experimentation of this type in the absence of measurement is doomed to fail, right? So to execute on this approach, the critical component is data. We have to have the ability to measure in relatively real time how we're doing. And so you're going to hear more from my colleague, Professor Greg Brown, on our data dashboard, which is designed to facilitate monitoring of some of these critical components that characterize this trade-off. But we're going to provide guidance on other aspects. So we're going to propose, for example, an easily digestible primer for business leaders on safety protocols. And further, we're talking about examining the disproportionate effects of the shutdown on different components of our state, perhaps with an eye to facilitating matches between, say, displaced workers and emerging opportunities. So to sum up, the healthcare and economic costs of this lockdown, they demand attention. And the goal of any economic opening should be to mitigate these important human costs. Again, the trade-off, it reflects lives and lives. And so the only path forward hinges upon a healthy dose of intelligent risk-taking informed by real-time, high-quality health and economic data. So with that, it's now my pleasure to introduce David Carroll. David was a longtime leader at Wells Fargo and its predecessor firms. And amongst other roles, David serves currently as a senior fellow at the Kenan Institute, and he leads this NC CEO Forum. So the floor is yours, David. Thank you.
Thank you, Christian, and good morning. Thank you all for joining us today. As Christian said, I'm a retired banker and currently a private equity investor, but more important to that, I'm a huge advocate for UNC and for North Carolina. I got involved in this work in March when Doug Shackelford, the dean at the business school, called and asked if I would be willing to help pull together a diverse group of senior business executives from North Carolina to study ways in which we could leverage the intellectual capital and resources at UNC, and more specifically at the Kenan Institute, to aid business leaders and policymakers in dealing with the pandemic. We pulled together a group of 18 CEOs and senior executives representing industries including manufacturing, technology, real estate, hospitality, financial services, health and human services, retail, education, and economic development. And I'm probably leaving a few out. The first thing that we did was we surveyed the group to find out what was top of mind. Where did they feel least equipped to deal with the pandemic? And perhaps most importantly, what did they need from policymakers early on? That effort resulted in about a dozen subject areas, mostly focused on the impact of the economic shutdown in early April. And it included things like, what's the prolonged impact for exceedingly elevated unemployment levels, supply chain disruption, impact on children, mental health, drug abuse, the disparate impact on diverse populations, testing and guidance for private enterprise on how to engage in that, fundamental shifts in business practices, and even identifying economic development opportunities in the aftermath of this disaster. Impact on caregivers, what will be the longer-term consumer behavioral and social norm activities, and then the economic consequences of the enormous debt loads to be shouldered by both private enterprise and governments as a result of the shutdown. So it was a long and varied list of subjects that our group came up with, but there were recurring themes throughout. And the very first one was the one that Christian talked about, and it was what this group identified as a dichotomy. It was the health outcome versus the economic outcome. And that gave rise to the work that Christian just spoke about. And my hope is that this group, this work and subsequent work will provoke a more informed, balanced, and hopefully less partisan narrative between business leaders and policymakers in dealing with this throughout. But I think it's important that we're all very clear. The healthcare and economic impact of this pandemic, it's the most consequential event in the world's history in the last 100 years. And I would include the world wars in there if you think about the reach of it and the economic calamity that it's causing. My fear early on was that there was the potential for worse health outcomes from shutting the economy down than from the virus itself. And while that's yet to be seen, actually, I still have a huge concern there. So this forum is focused on providing a fuller view of the impact of the pandemic, leading to more thoughtful and hopefully coordinated public and private responses to the virus. Christian mentioned this, but there are two other focus areas that we began to pay attention to. And the one that was recurring from all of our CEOs was the stunning lack of data. And here I'm not talking about just infection rates and mortality data, but detailed economic, behavioral, and social data to gauge the consequences of both the virus itself and the consequences of the economic shutdown. And we will have a response to that Greg will talk about a little bit later. Lastly, and we heard this from the start from healthcare professionals, this virus is likely to be with us for quite a while, not to mention the likelihood of future mutations, and that testing is key to managing the spread and to ultimately shutting it down. There doesn't appear to be widespread literacy, even 6 months into this, around testing, about what it means, what it doesn't, how it works, or how to run a comprehensive testing regimen across our state and across our country. And Greg also will touch on some work that's being done in that area as well. Those are the work streams that these 18 CEOs have given us their time and attention for, and we're most grateful for that. This work will morph over time, and we'll look forward to reporting back to you. But from here, I'll turn it over to Hope Bryant from First Citizens.
Thank you, David. I'm Hope Bryant, Vice Chair at First Citizens Bank. We're headquartered in Raleigh, North Carolina. We have over $40 billion of assets. We operate more than 650 offices in 19 states across the country, and I can tell you that there's virtually no aspect of our business that hasn't been impacted by COVID-19 since March. And frankly, we don't expect things to go back to business as usual, maybe ever. I'd like to share with you today 3 of the lessons that we've learned thus far and give you some insight into how we see this impacting our business. Our first lesson was really to set clear priorities. And for us, our top priority was the safety of our associates, that we believe that if they're secure in their jobs, then they can better help our clients get through this crisis. So thank goodness we'd invested in technology heavily over the last several years, and our IT team was able to send more than 2,500 associates to work from home virtually overnight. We currently have 70% of our more than 7,000 associates are working from home with a really high degree of productivity. And our next challenge was really keeping branches open and staffed and safe, as well as compliant across the country. Lots of challenges in this regard with shortages of supplies and the complexity and variability of state and local laws regarding reopening and closing. This continues to be a challenge with COVID cases spiking. Our second priority was really the care for our clients. And we lent more than $3.5 billion in the payroll protection program to keep jobs and businesses open. We approved more than 23,000 loans in about 6 weeks. And to give you some perspective on this, this is more than our annual loan volume. We also knew that many of our borrowers would be stressed, and we preemptively offered loan deferrals, processing over 20,000 of them in a matter of weeks. We had a streamlined process that was very helpful for our clients as well as our associates. So our second lesson was get the facts, use common sense, and empower our leaders to make decisions. We quickly found that our incident escalation process and disaster recovery program was a little bit overblown. So we switched horses and quickly set up a small team, giving them very timely data on many aspects of our business. We used infrastructure that was originally designed for stress testing, shifted it to make dashboards on all kinds of metrics, from credit portfolio analytics to incidents of COVID amongst our associates, branch transactions. You get the picture. These dashboards helped us specifically identify where we had risk so we could shore up those areas, but it also enabled us to keep many parts of our operation going business as usual to better serve our clients. We made leadership calls daily, covering all kinds of topics, and after covering the issues, we really empowered our local leaders to make the best decision they could to deal with matters that were most pressing to them. And what we found was doing it in this fashion was not particularly disruptive and far more effective than making sweeping corporate policies here in Raleigh. Our third lesson was innovate and work on continuous improvement. As I said, when we were participating in the payroll protection program, we had to quickly build processes for approval, booking, closing, and now collection and forgiveness, while the rules and the processes from the SBA and the government were still being crafted. It's hard to even imagine the magnitude of this challenge, but I'll give you some perspective. On day one, we approved 150 loans. It took 20 minutes each to get them into the SBA platform. And this was clearly not going to work as we were trying to serve tens of thousands of clients across the country. At the end of phase one, we were processing about 500 loans a day, and we approved about 5,000 loans in that phase, well short of the need. We kept refining our process with some improvement, but it really wasn't until a young IT professional gave us a breakthrough that he figured out that we could batch load loans onto the SBA platform. This was a game changer. By the second week in phase 2, we were approving 3,000 loans a day, and we had the process to close the loans in-house so that we could close them within days in our branches. It was a miraculous achievement, but it took many hours over many weeks with many associates across multiple departments to get this done. And really, agility was key. It's just amazing what you can do when you really feel like that you have to. While I think our process improvement was great, I would not give us great marks on communication. Internal communication I was very proud of that, but externally, particularly for those clients that were participating in the payroll protection program, we fell well short. They experienced frustration and anxiety. Our priority was on getting those loans approved because we were so fearful that the funds were going to run out. But we left them in the dark, and it was a nightmare for both our associates and our clients as we were working through the process. And thankfully, the second round of funding was ample to serve all of our customers that applied for need. Yeah, I'd like to shift gears a little bit and talk about the impact on our associates, and from our perspective, how businesses and consumers are coping. Across our markets, it really appears to be a barbell, that on one hand, many consumers and businesses have been severely negatively impacted, but then on the other, that they're finding great opportunities. Both have a sense of urgency. In the recent J.D. Power COVID-19 consumer survey, 25% of respondents said that the crisis had severely hurt or devastated their personal financial situation, with consumers age 18 to 44 being most severely impacted. On the other hand, mortgage volumes are exceptionally high as consumers take advantage of the current very low interest rate environment. In fact, mortgages are up 18% over last year, and refinances are up 76% from a year ago. Deposit levels are exceptionally high, driven by unprecedented savings rates by consumers and a desire for businesses to have more liquidity during a time of uncertainty. And we'll see what happens next week when tax payments come due, that surely they will shrink. But I think that what we all realize is that people have been staying home. They have not been experiencing lives as they've done in the past. And you see that in their spending. In April and May, merchant volumes were significantly lower because card usage was lower. This appears to be changing. New merchant sales data for June shows this actually higher than a year ago. And I think we all saw the pictures from the 4th of July that consumers are definitely out and about, and we see our loan pipeline strengthening quite a bit. I'll close with 3 challenges that I see as we move ahead. The first is operationalizing digital capability. While we've made great strides, there is so much to do on this front, and we've got much greater clarity about the magnitude of that challenge. Number 2 is we're going to have to adjust to a new normal. This will not be business as usual, and we will not go back to business as we knew it. For one thing, we will see greater work from home, which means that we'll have to manage for productivity differently, and we'll also have to figure out how to maintain our culture while people are working remotely. The requirements from our workforce will be very different. They will have to be more tech savvy. Good news for new entrants to the job market, but certainly a wake-up call for those of my generation. And then my final observation is that good data is key to success. We're moving with an increased sense of urgency, with more agility. We'll be reviewing our operating models and exploring ways to do things better, but we need much better data. And this is not just true for our organization, but I think really across the country, that if we're going to reopen our economy, our schools, and move our lives forward, we must have better data. And I'm excited about the work that the Kenan Institute is doing to address this need in North Carolina. I'm hopeful that the model can be replicated in other states as we reopen economies there. And I'm going to turn the microphone over to Professor Greg Brown to tell you more specifically about what they're doing.
Thank you very much, Hope. And first of all, I just want to reiterate that we find ourselves in a very tough situation. By itself, the pandemic is a difficult problem to address. There are many facets to the healthcare crisis before us. But as each speaker has already mentioned, the associated economic crisis adds a whole other layer to the challenges that we face. And it's very important for so many people, for the whole populace, that we consider all facets of both crises and that we do this in an objective and nonpartisan way. We don't claim to have any expertise on the healthcare side. We're not medical doctors or epidemiologists or public health experts. However, I will make a case shortly that more granular data on the healthcare front would be useful for everyone. However, we can provide substantial insights into what's happening with the economy and the broader socioeconomic impact by carefully analyzing data from a wide variety of government and private sector sources, and then making these data available on a dashboard for both business people and policymakers. The one unanimous opinion from business leaders that we talk to is that there is a need for more data. You've heard that from both Hope and David today. Many feel that they are flying blind given the limited amount of granular real-time data they have access to. So I'll make several specific comments below, but I want to begin by emphasizing that this is just version 1.0 of our effort. We very much want people to suggest additional data that would be useful to them, and then we can go about collecting and curating that data. So this effort is entirely about providing a resource for other people to make better decisions and lowering the overall cost of data collection and sharing. So we really appeal to the public at large. Please send us specific ideas or general ideas of things that would be useful. And furthermore, and as Hope mentioned, we really see this as a proof of concept as to what other states might pursue with their universities, private sector business leaders, and state governments. So of course, we're making all of our methodology and code public. So with that, I want to touch on 5 main points that came out of the data that we've analyzed and that are on the first version of our data dashboard. The first does concern the healthcare data. So if we look in, say, North Carolina, at deaths and hospitalizations and new positive tests, they're really telling us different stories as to what the current trend is of the pandemic. So, for example, death rates are telling us that the situation is stable or maybe even improving slightly. Hospitalizations are telling us that the situation is getting worse sort of slowly but steadily. And new positive tests are telling us that the situation is getting worse pretty rapidly. So what's really happening in North Carolina? And I should add that quite a few other states have divergent trends in healthcare data as well. Well, honestly, it's hard to tell. Death rates might be falling because of better treatment or different types of cases. For example, younger people rather than fewer cases. Hospitalizations may be increasing because of more new cases being admitted. Whereas a month or two ago, some marginal cases might have been turned away given concerns about capacity. We know that the number of new positive tests is very highly correlated with the number of total tests being done. Yet the positivity rate has remained fairly constant recently, which suggests that it isn't just better detection. There probably is an increase in cases as well. But again, it's very hard to tell with the data that we have access to. We need much more granular data to unpack what is happening. Ideally, we would know the age and location at the individual test and death level. At the hospital level, we would know the count in each hospital, the age and status of patients, at least on average. And by status, I mean whether they're in a normal bed or an ICU bed. And this lets us much better gauge capacity. And capacity is the second point that I want to come to. So in our framework, capacity is the key variable that drives openness of the economy. So for example, if we look in North Carolina right now, we're somewhere in the 70s, maybe close to 80% hospital capacity as stated by DHHS. However, it's important to remember that a relatively small percentage of current hospitalized patients in North Carolina are COVID patients. We still have several empty beds for every hospitalized COVID patient in North Carolina. Likewise, the ventilator capacity is quite good in North Carolina. We're using about 25% of available ventilators. So this does suggest additional capacity, but again, we have to be really, really careful not to end up with spikes that threaten this capacity. We've seen this now in Florida and Texas and Arizona and California, where hospitals can pretty quickly reach capacity. So again, what drives our ability to understand capacity? Better data. The third point I want to make is coming back to something that Christian mentioned, that there are pretty significant disparities in how people are being affected, not just by the disease itself, which is now pretty well documented, but also the broader economic impact. So more than a third of the population is deferring on healthcare needs. About 20 to 25% of the population is experiencing moderate or severe anxiety or depression. To try to get a better handle on this and exactly who is being affected disproportionately, we've created an index that measures socioeconomic adversity. So the idea is that this will track a composite of mental health, other healthcare needs, food security, and that we can see how certain groups are being facing more adversity than others. So in particular, what we find, and these are data that are on the dashboard, is that people with the following demographics are disproportionately affected: those with less than a high school education, Blacks and Hispanics, households with children, younger and middle-aged people, which may seem counterintuitive given that the disease impacts disproportionately older people, but younger and middle-aged people tend to be less financially secure and more dependent on wage income. Those with lower income in lower income households, and finally, single versus married people are facing more adversity. The fourth point I want to make is that even though the trajectory of the pandemic for North Carolina was quite a bit different than the trajectory for the pandemic in the rest of the US, economic activity in North Carolina tracks US economic activity very, very closely, remarkably closely. So this is understandable when you look at what's happened to the economy to date. There was this logical response of a rapid and widespread closure of the economy. And of course, this is going to result in very similar outcomes for North Carolina and the US. This was necessary. It was the immediate need to prepare the healthcare system so it didn't get overwhelmed nationally as it did in some cities. But going forward, this is almost surely not the optimal outcome. We need to have more localized solutions for how economic activity progresses. But again, do this reliably. Do it with policymakers and business leaders understanding the environment in which they're operating. My fifth and final point is what I think is really one of the most interesting issues around the economic reopening, and it's related to consumer behavior. So it's well documented now that many consumers, and especially older and wealthier consumers, are making their own decisions about safety regardless of whether establishments are open. So we first saw this as the pandemic unfolded and consumers pulled back on non-essential activities well before stay-at-home orders closed businesses. We've also seen it in many attempts to reopen, where governments have relaxed restrictions, but well-heeled consumers have stayed home. So while bars and dance clubs, might have a surge in demand by young people, traditional higher-end establishments and retail establishments in particular will continue to struggle. To capture the sentiment of consumers, we've created what we're calling a consumer consternation index, which essentially measures people's willingness and ability to undertake non-essential activities away from home. So as you would expect, consternation skyrocketed in March and peaked in mid-April. Again, the jump preceded the shutdown of most businesses. So the behavioral aspect is really more important than the policy aspect. Since April, consternation has fallen to about half its peak, but consumers are clearly still worried. Furthermore, the index looks as though it's beginning to tick back up, both in North Carolina and nationally, likely related to the recent spike in new cases in the South. So what will make typical consumers less concerned? It's simply a matter of feeling safe when they go out. So to this end, it's really imperative that there be a containment of community spread. And this means a much more compliant public, as Christian mentioned. We really need to have people taking public measures to ensure safety and a lack of transmission, as well as an effective test and trace program. By our estimate, there is still a very large testing gap in North Carolina and across the country. So with that, I'm going to turn it back over to Mackenzie, who's going to moderate Q&A.
Thank you, Greg. And thank you so much to all of our experts. Very happy to be moving into the Q&A portion. I just want to remind folks who have just joined our conversation that you are welcome to submit your questions anytime using that Q&A function at the bottom of your screen. For reporters who are with us, we are going to be giving preference to your questions. and we'll be prioritizing accordingly. I know we have a number of researchers and other community members with us as well, and we're going to do our best to get to all questions, but prioritizing those from reporters who are welcome to submit them again via Q&A or via email to me at mackenzie_bab@kenan-flagler.unc.edu. Our first question to open things up is for Christian. Christian, what is the data showing us so far in terms of the most vulnerable populations, and how should policy target support for those segments?
Yeah, so what we see in terms of who's been deemed essential, as well as the folks that are kind of coming back to work to the extent that that the opening facilitates, this is disproportionate along educational dimensions. That's obvious in some sense based on the kinds of jobs we're talking about. It's also disproportionate in terms of important ethnic dimensions, as well as age and others. And so, basically what that means then is the folks that are kind of keeping our economy together, as it were, are not all of us, and some have enjoyed very much the move to remote learning or remote. I'm coming from academic institution, remote working, that has not been mirrored necessarily in what others are experiencing in terms of what they're seeing in terms of their day-to-day lives. And so that's where then cases are spiking. That's where, for some, the economic impact has been particularly challenging. And so the question is, what can one do about policy? For example, this may be reasonably controversial, but I think one immediate thing one can do is, if we're going to talk about federal stimulus, I think there's an opportunity to simply cover all the healthcare costs associated with anyone that's struggling in a COVID-related situation. And so, as I said, one of the big challenges here is there are a number of folks that have been disconnected from their work that has healthcare implications through insurance. There are a number of other folks who we're asking an awful lot of that are now perhaps suffering with the implications of COVID. We're asking a lot of certain components of our society, and I think one possible policy tool is to immediately address the healthcare considerations of those that have been disproportionately affected.
Excellent. Thank you, Christian. Our next question comes from Aaron Sanchez-Guerra from the News and Observer. What are the panel's observations of Governor Cooper's reopening / the economic shutdown? How could our North Carolina leaders use data-informed decisions to save the economy while protecting health? So I'm going to open that up for all of our experts and let folks jump in with different observations as they'd like.
I'll go back to some of the data that we've been looking at, which suggests that there are sort of ways that the government can clamp down on economic activity. So you can pull on a string, but in some cases it's hard to push on a string, in the sense that opening the economy back up doesn't necessarily guarantee that people are going to participate. So I think that it's when we think about what the policy response should be, it needs to be more than just sort of the proverbial turning the dimmer switch. It needs to be understanding from a full spectrum, what are the things that matter to people in the economy, and feeling safe is a big part of that. So I think any comprehensive policy solution needs to really take seriously how people are behaving in the economic side as well as on the healthcare side.
Hey, Mackenzie, it's David. I would add two things. One is we all need to recognize that we're all making this up as we go along. No one's had any experience doing this, and it's so easy to second guess the authorities and what they've done and what they've not done. And I would give the governor and the state high marks for doing the absolute best they can, and have two requests. One is that they endeavor to give the public and businesses as much advance notice to their policy decisions. I've talked to businesses, large and small, and getting the rules of the game, so to speak, very late make for very difficult implementation, very inconsistent implementation. And the last thing is to consider this notion of one size fits all probably is not applicable here. the risks in different parts of the state, the risks to different cohorts are different. And so endeavoring to deal with inconsistencies going both ways would be really useful. But I don't think it's helpful to feed the political rancor out there by being critical. I give the state and the governor high marks. I do think we can do better the longer we're at this. And unfortunately, it looks like we're going to be at it for a while.
Absolutely. Thank you, Greg. Thank you, David, as well. Our next question comes from Holden Kerwicki with CBS 17. Many businesses have moved to work from home business models. Is that model economically viable long term, or do you lose the level of productivity without workers in a traditional workspace? I know, Hope, you were mentioning this earlier. The second part of his question is, would new hospitalizations each day be a relevant measure of severity and be more time accurate than overall hospitalization numbers/rate? So I hope you may want to take first stab at the first part of that question, and others may want to chime in as well, but maybe we can start with you.
Okay, thank you, Mackenzie, and I'm happy to. I think that we will be very surprised at how high productivity can be from work from home. I think we may have a little bit of a bias that face-to-face interactions are significantly better, but in our business, we have been very much surprised the other way, that client interactions, sales activities have really worked very well. I will have to say that the productivity, those departments that had better metrics going in have done better. And we've surveyed our associates, and sometimes they think that they're a little bit more productive working from home than we think that they are. But I think that overall, yes, that work from home in many other aspects of our business model will be a sustainable initiative, and we'll just have to figure out structures to put in place to make it work better. But I do think that we'll have to work through, how do you foster teamwork? How do you build culture and those kind of softer things that people aren't interacting in a face-to-face manner.
Yeah, I would add to that. So there was an interesting commentary from the Manpower Group the other day on Bloomberg. So they have the finger on the pulse of all of this, right? And they were sort of contrasting what they viewed as, productivity versus presenteeism. Are you actually present? And their takeaway is, on average, exactly this conclusion that the degree of productivity is going to be pretty interesting, that we're going to learn from all of this. That having been said, again, there's a lot of heterogeneity within the experience. So if it's, someone like me with older kids and they run off and play video games or something, that's fine. But if it's somebody with a child underfoot, we're talking about, fundamental negative hits. So it's correlated with other things that are going on that are sort of governing our experience right now. And part of that is, the reason we're forced to conduct this experiment is because our kids aren't in school and things like that. So if you sort of look at this in isolation, I think we're going to learn some pretty interesting lessons. I mean, I'm not sure when's the next time I'm going to get on an airplane and travel around the world. And that's been the better part of my experience over the last 20 years. But right now it is commingled with some different challenges, I think, that we're facing.
And I think the other thing to highlight is that it's very job and industry specific as well. So there's some emerging research already looking at productivity by type of worker and by industry. And of course, some jobs you can do remotely, some you can't, some are more efficient to do remotely. And so, if you look at the aggregate, it looks like, maybe the optimal, there is some benefit to working remotely, but there's some interior optimal there. It's not 100% remote. It's maybe 30 or 40% remote, because there's some things you can do better if you're not disturbed, or, by not having to bear the cost of commuting or whatever, but other things you need to be in person for.
Definitely. Thank you all so much for those thoughtful answers. That next question that I posed is a bit different, but I'll pose it back to the group. And Greg and Christian, you may be the best to take first stab at this. Would new hospitalizations each day be a relevant measure of severity and be more time accurate than overall hospitalization numbers and or rate?
But I think those are measuring two different things. So the kind of overall hospitalization is telling you something important about capacity utilization in the healthcare service sector. So you certainly don't want to ignore that. But looking at the trends could give you a better indication of what's happening with cases than testing if you don't have a good testing regime. So the challenge is that we know that the disease affects different populations very differently, right? So for example, it's quite severe for older parts of the population and less severe for younger parts of the population. So if you have a massive spike in new cases among young people, they may not show up in hospitalizations. And that's likely what we're seeing right now as young people get anxious and think it's less of a risk for them and not appreciating the broader context in which their behaviors might have an impact.
Great. Christian, did you want to add anything to that, or was that pretty much what you were going to cover?
Exactly that. There's two dimensions that are complementary, and I think Greg stated correctly.
Fantastic. Our next question comes from Rebecca Martinez with WUNC, and it's for Greg. Where can we access the Consumer Consternation Index? Does the caution of well-heeled consumers outweigh other groups who want to resume business as usual? And then finally, what is the role of government in containing community spread while reopening the economy?
Yeah, so the index is available on the dashboard. We have a plot of it there, and you can download the data for it specifically for the US and for North Carolina. And there's a data methodology that describes what the inputs are for that index and how they're weighted. So, in terms of sort of which consumers are important and matter and such, I think the problem is that in order to get back to the level of economic activity that we had pre-crisis, we need everybody, right? So everyone, in some sense, needs to return to something like normal, whatever the new normal is, where they're fully engaged with the economy. And so the reluctance of older and seemingly wealthier participants in the economy, they're quite an important part of the economy. So it isn't for their benefit that we care about this, it's for the broader economic benefit. And in fact, another one of the statistics that we have on the dashboard shows what's happened to employment by the zip code, where zip codes are low income, medium income, high income. And what you see is that the impact on low income households is more severe in high income zip codes, because that's where spending pulled back more. There's more discretionary spending among these higher income groups. And so if you think about retail and restaurants and other things where a lot of this discretionary spending happens, it's going to be in higher income zip codes. And that fallout from that actually has a bigger impact on lower income people than higher income people.
Got it. Thank you, Greg, for that. Our next question comes from Rose Hoban with North Carolina Health News. She says, if you're looking at reopening in other states, such as New York, what lessons from other states would you advise Governor Cooper to adopt? And I'll open this to the group as well.
I'll chip in, Mackenzie, and tell you, since we're opening offices across the country, that it is some of everything. There is no rule book, game plan, that it is very situational. And we have offices in Washington State and Oregon. They were early into the pandemic. They shut down things early. They're coming back much more quickly. We have offices across Florida, and that is not the case. We actually have closed more offices today because of challenges with COVID spiking there that have been interesting. In addition to the pandemic, civil unrest has had as nearly as big an impact on our reopening as the pandemic. So you really can't take a broad brushed approach. I think that Governor Cooper's ability to look at real data and get into the specifics of it and craft a plan that is maybe more specific to individual counties or communities versus looking at the state as a whole may be more effective.
Great. Thank you so much, Hope, for that. Our next question comes from Edwin Barnett. It's posed to Christian and the panel. Is there a consensus yet on where the 2 or 3 mistakes that were made early on in the COVID-19 response were, and are any still being made?
I wouldn't say there's a consensus on anything, but of course that's because it's muddied by tremendous political nonsense, right? I mean, I think, look, I mean, I second exactly what David said, which is, you know, we all got whacked with this thing, and we responded in the way that we were best able to, which was first with shock and then with shutdown and so on and so forth. I would say, you know, I think one personal view I have on this, the danger is that it's migrated from a management process into a categorical illusion of safety, which is impossible. It's simply a mirage. And so, again, I come back to kind of the framework that we presented in that light, which is not fully agreed upon, I think, by everybody. And so I view that then as, if you want to call it a mistake, or at least a misconception that needs to be, you know, sort of addressed, is that we've got to tackle a number of challenging things at the same time, which are pulling in different directions, right? And so I think that's the lesson I think that we should be learning from all of this, rather than early mistakes, so to speak. So again, if anything, there's kind of a brewing misconception or a changing narrative that safety is achievable, and it's not.
You know, Mackenzie, I would add 2 thoughts on this. As to Christian's point, there's very little consensus on anything regarding this subject. But one thing that comes to mind that's startling, that there has been a very consistent refrain from healthcare officials around the world, and I've read data that would suggest that over 75% of the spread can be contained with 3 things, 3 simple behaviors that we're all capable of participating in: social distancing, wearing a mask, and washing your hands. And 4th, not touching your face. It's the physical distancing. And that has been very consistent, and it's been reinforced the further along we've gotten with the pandemic. And I find it unsettling and peculiar that and this is largely a local authorities phenomenon. Local authorities seem very reticent to enforce the guidelines. And I doubt anybody on the call here has not witnessed group functions in public as if it were a year ago. I'm just startled that local authorities don't go in with some modest level and not being unaware of the other social issues going on in the country. But I've seen hundreds of people packed in lines at various venues around the state and in other states that I've been in. So I would think we can all do a better job individually with reinforcing those 3 things.
Yeah, I would exactly second that. I think the navigation of this set of trade-offs is not as daunting as it seems when there are some clearly, you know, prescribed things that we could do. I think one of the earlier questions, and we didn't get to the second part of it, I'm just reminded of it, is, you know, what can the government do to mitigate, you know, sort of community spread? These are things which work. The government or local governments can certainly act in this way, but if you allow me to editorialize for a moment, like, this is our compact with one another. That's what a society is. That's a government is simply a reflection of all of us. And I think it's a responsibility of the citizenry, frankly, to step up and take care of one another. It's baffling to me that Americans have relatively fallen short with respect to, say, our European counterparts, which seem to be doing far better along some of these dimensions.
I'm equally befuddled, and as I was sharing with some of my colleagues this morning, a dear friend of mine gave birth over the weekend wearing a mask. So my new mantra is, if she can do that, then people can hop on a mask to go to the Piggly Wiggly, right? So our next question comes from Chantal Alum at WRAL TechWire. Will North Carolina be ready to go to phase 3 on July 16th? And what can we expect economically? Christian and Greg, you may want to take first stab at this.
I hesitate to open on that, just given how rapidly the pandemic seems to be evolving nationally as well as in North Carolina. I don't feel like I can look at the data that we have access to and say clearly what's happening in North Carolina. So I think we're just going to have to wait and see. We'll get quite a bit more information about current trends. And again, I think what does that really mean for the economy? Again, I don't want to keep beating the same drum, but there is this notion that people have to be willing to participate in the economy and feel safe going out and conducting business for opening to really be sustainable and effective. So I don't feel like we're there yet. And to go back to the previous question, I think there was a mistake made. I don't know who made the mistake, but to not fully appreciate the importance of testing. That the only way to really get a handle on the pandemic is to eliminate community spread. The only way to eliminate community spread is to have extremely widespread testing and tracing. And this is really, I think, something that is crucial. And we're really not going to be able, absent a vaccine, not going to be able to conduct business the way that we would like to and have the economy reopen the way we'd like to until we can get testing and tracing to the point that we're eliminating community spread.
Great, thank you, Greg. One other question that was posed earlier, and I don't think we got a chance to cover it, is does the caution of well-heeled consumers outweigh other groups who want to resume business as usual? And I feel this group would be well suited to reply to that. I'll open it up for the panel.
I don't know. I think we're in an interesting situation where those folks have greater degrees of freedom to disengage from the economy for the moment, and to the extent that they're relying on delivery services and whatever, that's also then imposing, again, this disproportionate cost on the other components of our society. So I don't think that's going to be alleviated anytime soon. That impulse is going to be mitigated because of the reasons that Greg articulated, which is if you don't have to go out, and then perhaps you won't until you feel that it's safe to do so. But that doesn't mean they're still not engaging in some level with the economy, so to speak, and the extent of those engagement points touching on, again, other folks in our society that are being asked to do a lot. I think that's a pretty tricky equilibrium to be in for too much longer.
Absolutely. The last question I think we're going to have time for is a follow-up from Rose Hoban, who says the ACA is back in the news as the administration has asked the Supreme Court to strike down the entire law. Has anyone modeled what adoption of Medicaid expansion in North Carolina would have on economic health? Does anyone have thoughts on this policy? Again, I'll open that for the panel.
But I think people have done that analysis, and we're not the right people to ask, but we would be happy to refer folks to other experts at UNC that have done that.
That sounds good. We can definitely make that happen, and that leads us right to closing. So I want to thank everyone so much for participating. Again, the link to the data dashboard that we've been discussing today, which was just launched this morning at 8 a.m., is available both in the media advisory that I've been sharing with folks, as well as on our homepage. If you visit kenaninstitute.unc.edu, you can access that data dashboard. As our panelists have said, we welcome input. We welcome your ideas about what additional data points could be useful in making these vital decisions moving forward. So please feel free to be in touch with your thoughts. Additionally, for reporters who would like to schedule any follow-up interviews with any of our experts, I'm happy to set those up. I know that we did not get to all of your questions today, but I want to thank you for asking so many thought-provoking ones that we ran right out of time. Please feel free to be in touch. Happy to set up additional conversations. with you. And with nothing more, I think that now that we're officially over time, we'll wrap. We hope to see you again. We'll be doing another press briefing later this month. So please stay tuned for more information on that. Until then, stay safe, stay healthy, and take good care. Thank you.